For my research, there's kind of three different kind of ownership models for a doctor's practice. I have here hospital and health system owned, and then kind of the second bucket being health insurers, pharmacy chains, and private equity firms. And then you kind of have the third bucket being this independent practice. Is that the right way to like think about it or frame it up?
Yeah, those are definitely the three ownership models in healthcare. And this is an industry that back in the 80s was largely in that last bucket that you said, largely independent owned. These practices would even transition through generations, right? You'd have in the family, you'd have, kids that become doctors and take over the practice. And there was this sort of pride and proudness around having an independent practice, being the center of your community. You even talk to doctors today in small towns where they get recognized in the street, right? In the bookstore, the coffee shop, and there was this pride of serving your community as a doctor. And I think what you've seen over time is basically a swing from that last independent bucket into some of those others. So the largest employer of physicians now in the country is UnitedHealth, which is a payer, and the other payers followed suit as well. Obviously, they employ a lot of physicians through entities that they own. In the case of UnitedHealth, it's through Optum. And then you also have a lot of private equity firms and other corporate entities that have gotten into the business of operating medical practices and employing doctors.